an allergy problem, it's really not an immune deficiency. It's an excess immune response. And what happens is the body makes a chemical to a particular food. Usually it's of a class called IgE, where the two connect, the antibody and the food, let's say for milk. When that happens, there are cells in the body called mast cells. And those mast cells release chemicals, one of the major chemicals being histamine. There are probably others. Histamine has several impacts on the body. It causes the vessels to swell, it causes the vessels to leak fluid, and it causes the airways to close down. And if it happens all over the body, probably the first symptom is abdominal pain in many instances, because there are many more arteries and vessels in the abdomen that close down first and constrict. But then it goes on to, in a cascade, to have a skin problem, gastrointestinal problems, respiratory problems, circulatory problems, and then central nervous system issues. The most dangerous thing is the third spacing of fluid, because once the fluid starts third spacing, the blood pressure drops, and it's very difficult to intercede at that point, finding a vein or a vessel to use. The only drug that should be considered in any evidence of anaphylaxis is epinephrine. No Benadryl, no steroids, none of that. I can't tell you how many children have gotten into trouble because Benadryl was the first drug of choice. If you have a child who has that kind of a problem, then everybody has to be involved in the discussion of what to do if something happens.